Becky. We now will move to a series of 3 presentations to stimulate our thinking about, more specifically, about animal nutrition research. Our first speaker is Dr. Daniel Thomson. Dan is a 3rd-generation veterinarian from Clearfield, Iowa. He earned a BS and a DVM degree at Iowa State University. Then he moved to South Dakota State and earned a master's degree, and then to Texas Tech to earn a PhD degree. He currently is the Jones Professor of Production Medicine and Epidemiology at Kansas State University, and he's the director of a Beef Cattle Institute at Kansas State. He teaches production medicine, welfare, and nutrition. He's internationally recognized for research on interactions of production, management, environment, and nutrition on health and well-being of beef cattle and other animals as well, but primarily focusing on beef cattle. His topic is animal nutrition as a factor in farm animal health and welfare. Dr. Thomson, welcome.
Well, it's my pleasure to be here, and I was super excited to get the invitation from Dr. Bites to spend some time with you. I'm a former student of Dr. Bites, and he's one of those teachers that inspired a lot of us, and I appreciate him continuing his leadership here with y'all's group. I'm going to speak today about animal nutrition as a factor of farm animal health and welfare. And the one thing about animal welfare that I've learned, I never thought I was going to be an animal welfare type person, but I think any of us that are involved with nutrition or involved with production medicine or animal science or veterinary medicine are involved with animal welfare on a day-to-day basis. And I think that we need to understand that animal rights groups use animal abuse cases to drive animal welfare legislation. And animal welfare is totally different than animal rights and completely different than animal abuse. Animal welfare is something that we do every day. It's doing the chores, it's providing nutrition, it's preventative medicine, it's taking care of the animals that take care of us. And so as I describe and talk about animal welfare and interrelate that today, it's not a destination. Animal welfare is a journey. And everything that we have done through the Journal of Animal Science, the Journal of Dairy Science, the Journal of the American Veterinary Medical Association has been a journey of developing new platforms and leading us to the animal systems to provide the best animal welfare that we can. So with that, some of the core things that we look at the Beef Cattle Institute as far as understanding, you know, the One Health, as Dr. Wotecki mentioned, you know, the healthy cattle, healthy people, healthy planet type of triad. And really what we're talking about is animal welfare, animal health and welfare, food safety, and environmental stewardship. And in the middle of that, we keep having this word sustainability that pops up that still needs clarity and definition. But the one thing I can assure you from being from the state of Kansas and being raised in a rural environment in the state of Iowa is that there will be no sustainability without profitability. And sometimes people forget that farms and ranches are businesses, and we're not doing this just for the betterment of society, although we do tend to bear the cost many times and incur things as cost of production to continue to perpetuate our heritage and what we do as far as the way of providing food for man. This is one of our farms in southwest Iowa, and my daughter there fishing in the pond next to our cows, and it always amazes me that somebody that lives a long ways away from Taylor County, Iowa, thinks groundwater safety or environmental stewardship is more important than us that live there. But anyway, animal welfare is well defined by farm animal by the Farm Animal Research Council, and these are the 5 freedoms: the freedom from thirst and hunger, the freedom from discomfort, which is cow comfort or pig comfort or housing, the freedom from pain, injury, and disease, and this is the veterinary client-patient relationship, disease prevention, and things to that. Freedom from fear and distress, something I'm still trying to get in my life, but freedom from fear and distress is the human-animal interaction. That's the cattle handling, that's the swine handling, that's what we talk about in there. And then the freedom to express normal behavior, that is the ability for the animals during times of heat stress to find shade from natural behaviors that they would gregariously participate in, that we allow those types of behaviors. However, in society, animal welfare is not very well defined. And I serve as the global team leader for McDonald's in beef cattle health and welfare. And we have 331 packing plants that supply beef to the McDonald's restaurant chains internationally. And we conducted a survey at McDonald's of the McDonald's consumer and asked people in different regions of the world what to define animal welfare. And if we asked 6 people what animal welfare was, we got 7 different answers. But the 2 things that came clear from that survey was, 1, the consumer relates a safe food product as one that comes from a healthy animal. And number 2, an animal that is healthy is one that was taken care of with good animal welfare. So McDonald's then made animal health core to their animal welfare movement or their animal welfare mission. And so when we looked at moving this type of platform forward, as Dr. Wotecki says, of looking at social and academic interactions, I really think that animal health, matter of fact, we changed the Animal Welfare Committee at McDonald's to the Animal Health and Welfare Committee just to accentuate that. But the one thing we do in science is we don't understand yet what normal animal welfare is. We have a lot of input practices, and we say the animals should be given this amount of space, or the animals we should be delivering feed in this manner, or they should have this much bunk space or this much water tank space, but we really don't know yet what the outcome measures are and how those are normal. When I went to veterinary school, the first year of veterinary school, all they do is just provide you normal. And for a year, we study what normal is, and we look at normal lungs, and we look at normal histology, and we understand anatomy and physiology and microanatomy. And then we come in as sophomores, and they set this down in front of us, this set of lungs, and I say, wow, I know those are lungs, and I know that's not normal because I just spent a year looking at normal. And I really think that we have to get to that point in animal welfare. I chaired the OIE's Beef Cattle Health and Welfare Committee to set forward the terrestrial code for beef cattle health. And the one thing was anytime we wrote code, we had to come up with a way that we as a veterinarian or we as an animal producer would walk out into the field and be able to assume or assess animal well-being based on typical animal measurements that we take on a day-to-day basis. So how do I assess animal welfare in the field? And again, that's getting back to understanding what normal is and then being able to understand what abnormal is. This is kind of the equilibrium, or as we move from the center, which is good animal well-being, to the outside, which is poor animal well-being. And as we move through, you can see how we assess on one side different preference tests, physiological changes, so blood parameters and serum chemistry changes, to then behavioral changes, to then disease, and then death. And as you look at the impact on the animal, we'll start to have physiological imbalance. And so there are phases, or there are levels of animal welfare changes that maybe we won't be able to see clinically, that we still need to have basic animal research to get to that point, but we need to make that translation from that basic animal welfare research to where we can make determinations and changes on a herd-by-herd basis in the field. One of the things that I said, to change the outcome, you either have to change the process, distort the process, or distort the data. And I would hope that as we determine what's normal in the future, that we'll learn to help change the process. Now, when we look at veterinary medicine, this is adapted from Louis Perino, the one thing I don't want to discredit is practical experience in the field. because farmers and ranchers spend a lot of time understanding their animals, understanding their climate, understanding their geography that we might not learn in a textbook or in a scientific article. And however, when we only use personal experience and we don't use data at all, we practice the term wizardry, okay? And when we do have only people that only understand scientific data and only do critical evaluation, when the storm comes or when the outbreak occurs and somebody needs to drive the loader to make movements of mud or to help put up shades, those people are in paralyzed indecision because they've never done it. And so the balance of being between paralyzed indecision and wizardry is what we call outcomes-based or evidence-based medicine, and I hope that we can get there. Some of the things and issues that I see coming down the road as far as interactions, my PhD and master's were in ruminant nutrition, and I went into private practice at Cactus Feeders, which at that time was the world's largest cattle feeder, and didn't take me very long to understand that veterinary medicine and the interaction of veterinary medicine and nutrition really became evident to me of this systems approach or this understanding of welfare. And so I'm going to go through some of the things. I'm going to try to not be completely biased towards beef cattle, but understand that's my life. Although I have worked a lot. I went to Iowa State University, spent a lot of time with swine. We called it pignostics, not diagnostics, in our diagnostic laboratory. So I do have a background in swine. But I think that body condition score is very subjective. And it's something that is utilized. Abbas Muhammad from the Kenyan Livestock Marketing Association was sitting next to me as we put body condition score down as an animal welfare indicator for cows. And he says, that's great, but I want you to understand in Kenya we have a point in time where we're going to have a very dry season. And our cows are going to get extremely thin, but we don't want to sell them. And we don't want to move them. And so, when I look at the drought conditions that we have and people selling their herds and the dispersal of cow herds in the United States because of lower body condition, it's one of those things that I think we need to have a more clear definition of when we're getting into trouble with some of these animals in extensive systems. Also, cull animal quality. Our cull cows, our cull sows, our cull hens, the quality of those animals and the body condition score and the value of those animals going into the food supply, I think is something that could be of a big understanding, because these animals are used extensively in food around the world and specifically around the United States. I think metabolic overload, the opposite of the starvation or the decreased body condition score, understanding the man-made causes of animal welfare issues. When we look at dairies, the laminitis, the ruminitis, we're doing some harvest audit program research right now, and we're finding about 10% of these dairy cows have rumens that are completely devoid of papillae. And so when we start to look at acidosis models and it's the same in our cattle feeding situations where we have perpetuated acidosis issues, liver abscess is not only a feedlot cattle issue from increased soluble carbohydrate, but it can also be something that we see in our dairy cows that are being culled. But I think that when we look at pushing the envelope and maximizing performance rather than optimizing performance, and having that balance of optimal health, optimal performance, increasing the production time of these animals rather than maximizing it and having such high rapid cull rates out of our herds is something that could be something of national and international interest in both the market hog and the feeder cattle segments. How large we're feeding these animals today. We're decreasing the number of animals that go to slaughter, but we have an increase in the body size, and so there are some things that are going on metabolically at the end of the feeding period where those animals simply can't handle the stress of transport, and so I think that those are some of the things that we'll have to take a look at. And I preach to our students all the time about, animal nutrition is not just mixing the ration And it's not, it's about feed delivery. It's about understanding of social hierarchy within pens. And when I get called to feed yards as a clinician and I do a necropsy of animals that die of no visible lesions, and you open up the rumen and it's empty, they're offered ad libitum feed, but when we don't provide enough bunk space, the smaller animals are the ones that get pushed to the side. And so understanding animal behavior, understanding feeding systems, watering systems, we still don't have definition on bunk space. We still don't have definition on proper water tank space for different classes of cattle, different types of animals. And are there novel ways of delivering feed or delivering water to these animals is another one that sick animals don't eat, and animals that don't eat get sick. And so understanding the interaction of being able to get all the animals to the bunk is something that I think that we'll have to address. I think on animal nutrition and times of animal health issues, the two biggest things, at least in cattle and pigs, the neonate and scours or diarrhea, and then at the point in time of maternal separation are two types of places that nutrition research really needs to be focused. And whether it's colostrum or whether it's supplemented colostrum at the point in time before gut closure, are there things that we could be doing to manipulate the animal's immune system through nutrition while we can still get proteins across the gut wall? Are there ways that we could enhance animals' production or performance or health at that point in time? We definitely know we can with health with immunoglobulin transfer, but we need to be looking at other ways to manipulate the animal before gut closure. And then at weaning, one of my dreams, when we've done some work in swine, I patented a product to look at protein. The piglets would drink 3 days prior before taking a bite to eat. And so we started supplying liquid nutrition to those animals. And are there ways to deliver liquid feed to cattle and potentially stop that leaky gut syndrome and enhance some of our decrease some of the shipping stress or bovine respiratory disease issues that we see around the time of weaning. But weaning management, some of these soft weaning managements, when we look at just separating the animals by fence or some of the ways that we can reduce stress while we're transferring these animals from a milk and grass-based diet to a totally mixed ration, trying to find ways to get animals to eat sooner, whether it's baby calves that are on starter diets, that are on milk replacer, or whether we can get some of these calves on dry feed a little bit sooner, or piglets to eat sooner, are some things that could be of this. They asked me to touch on antibiotic residue or resistance, and really my mindset is this, is that we have done a great job in our country of focusing on antibiotic residue avoidance. And as you can see here from FSIS 2012 data, we have very few residues showing up in the animals that are presented at slaughter. And our veterinarians, farmers, ranchers do an incredible job at preventing antibiotic residues because we provided them the education and we provided them the goals and the strategies. That's the thing that we need to do on resistance, and we need to transition from an antibiotic residue program to antibiotic stewardship programs and antibiotic residue avoidance. So how do we move forward on these? I don't think you can move forward until we really get the premise identification and animal traceability moving forward. And that's a big leap and that's a tall task, but it's something that we definitely will not be going backwards on. When we look at other countries that have this system, it's the key to understanding. We need to have a consistent and applied way to report antibiotic usage, whether it's swine, whether it's beef cattle. We need to know where the antibiotics are, how they're being used, how they're being applied, whether it's through the water system, whether it's through the feed, whether it's parentally, but these need to be reported. Every antibiotic stewardship program in human medicine, the first and foremost thing, it reports the use of antibiotics within the hospital. And we need to be able to do that within the production units. It's not saying that you dictate what's being used, but it is that we need to know what the individual farm or the veterinary practitioner is utilizing. We also need to provide evidence of antibiotic resistance. I keep hearing, Campylobacter, Salmonella, E. coli, third and fourth generation cephalosporins, fluoroquinolones, and macrolides. Those are the three that pop up on each side of this equation. It's foodborne pathogens. And so it would be quite simple as our packing plants are taking analysis and constant surveillance of foodborne pathogens to go ahead and do culture and sensitivity. And let's just show, instead of just having mandates come down of thou shalt not use antibiotics, or the other side is use whatever you want all the time, we really need to provide evidence on whether or not we're creating issues or not. Development of the antibiotic stewardship programs, these are easy, they're outlined. The CDC has outlined the core elements to an antibiotic stewardship program, and I think this will be farm-based, and the veterinarian will be heavily involved in doing this. We need to continue to do research without the use of antibiotics within our production systems, and continue to try to use technology such as vaccines, probiotics, and things of that nature in animal nutrition research to find proteins to move it forward. Metabolic modifiers, whether it's beta agonists, BST, or steroid implants, are constantly going to be scrutinized. I think that having a good understanding of their impact on animal health and behavior in the last 2 years, we've been working extensively with the beta agonists in beef cattle and found that, the one thing I want to make sure that we don't do is I don't want to throw out technology without proper research and proper evidence. It's easy to say, well, let's just get rid of this product. It's easy to say, let's get rid of this technology. When I was in as an executive in a cattle feeding company, people were the easy things to remove. Well, we can get this job done with one less person. Okay, and that's one less workman's comp. That's one more, and so we tend to look at the things that are easy to remove rather than the things that truly are worthwhile in making the changes, which are trying to change the management systems in which we raise the animals, the marketing systems in which we transfer the animals, and the number of people in which we employ in our operations. And so, environmental impacts, I'm not going to touch too much on this, but we have short-term emergencies when power outages occur, and being able to provide feed during winter storms, provide cover during heat stress, and then we have long-term inadequacies. Are we allowing these animals to express normal behavior in the production systems that we have? And that all incorporates, with chewing your cud and being able to move forward. And I'll quit with a couple of comments here. But I was thinking about this as you come to Washington D.C. and I've graduated in a high school class of 8 in Southwest Iowa, and so this is a lot of activity in this city for me. But when you come here, you start to think about, what's really going on. And when I think about technology, I think about antibiotics, I think about people with animal welfare or animal rights. The two groups that don't care about food science are the independently wealthy and the starving. They say a person whose belly's half full has many problems, and a person who's starving's got but one. They need to eat. And the people that are independently wealthy, the person who really science works for is the blue collar and the white collar person that is on a budget, going to the grocery store saying, this product costs me more, this product costs me less. If this one's truly safer for me and my family, or more wholesome or more nutritious, then I will balance my budget to make the decision to provide for my family. The group that doesn't care about money because they have too much of it, or the group that just needs to eat, they don't care. And I would say that we need to be careful in who we listen to and how we go forward to make sure that when we do use these technologies, or when we make the changes, that we're doing it for the right reasons, to improve the health and the well-being of the animals, to improve the product for our consumers, and to make it more profitable for the people who have decided to make their life living with the animals and raising them, our farmers and ranchers. I thank you very much.
Thank you very much, Dr. Thomson.